Hi, my name is Cynthia Solasa. I'm a nurse practitioner here at Beautilase Med Spa.
Hi, my name is Elizabeth Huerta. I'm a nurse practitioner, injector here at Beautilase Med Spa.
Okay, Liz, so tell us a little bit about Botox.
So Botox, one of my favorite things here at the Beautilase. What it is a neurotoxin that's injected into certain areas of our face. What it does is that it temporarily paralyzes to help decrease or soften expression lines.
Okay, and what should patients look out for before they come in to get their Botox treatment?
So I always say, if you're waking up in the morning and you're seeing some lines on your face, it's time to get Botox. Botox is safe. It is for anyone over the age of 21, but we have patients that come in and they're in their 60s and 70s and still enjoying the benefits of Botox.
Okay, and what about aftercare?
So after Botox, what you want to do is be aware that you will have some red marks on your face. You may experience a mild headache after Botox, which you can take Tylenol for. Also, at times you may experience a bruise, but of course they will resolve shortly in a few days. More importantly, the post-Botox precautions include not to massage the area. That is the one thing we don't want you to do, because we don't want that medication or the neurotoxin to get into areas that it doesn't belong. We encourage you to make expressive facial movements just to get that Botox in there. Do not lean forward excessively for 4 hours after treatment. No exercise for 12 hours. And again, if you have a mild headache, you can take Tylenol.
Perfect. Now, some patients, they are always worried about their Botox not being effective within a few days. How long should they wait before they see the full effects of Botox treatment?
That's a great question. So we all the muscles, everyone, it works differently on them, but we can expect for you to see some results within the first 24 hours, but the full effect can be up to 2 weeks. So if you look in the mirror and you still notice that one of your brows is still going up and the other one isn't, do not worry, do not panic. If you have any questions, call us, but that is a normal expected finding that can occur.
Okay, perfect. And one last thing about Botox that we both have learned about over and over again that Juvederm stresses is Botox dosage equals duration. The amount of Botox that they get, sometimes it's not enough, and they'll say, hey, well, I've gotten this amount, but the dosage amount that the patient is going to get is going to also equal the duration. Tell us, how long does Botox normally last?
So usually the Botox, it'll vary from person to person, but on average, it's usually around 3 months. Of course, if a person exercises or metabolizes the Botox differently, it may be less. In our experience, 3 months to 4 months is a usual time frame.
For the patient to come back in,
Yes.
Schedule an appointment and come in so we can work on your treatment area.
One thing I do want to stress about Botox is the importance of knowing who's injecting you. Oftentimes we hear stories about how certain individuals are injecting without a license, or things that you just need not to be involved with. Botox is a neurotoxin, and you should be aware that the person that's injecting you is trained and certified to inject Botox.
Okay, and a couple of things that they can do with that is take a look at the Botox.
Take a look at the Botox vial. Always know that there's a specific hologram on the bottles that should be made available to the patient so they can verify that indeed they are getting Botox.
Excellent.